So, as a medical professional who works day in and out dealing with all these different chemical dependencies, what are the few most common drugs? Because, like, when we do a drug screen, there are like 10 different drugs, right? And there are a lot more that are not in that screening process. And I see in the ER there is more evolving, like I would say almost every other day,
Yeah.
what we call as street drugs or illicit drugs. So, what do you see as like what are the top like few that are more challenging for you and what you are more concerned about?
Sure.
Right.
Unfortunately, 83% the times you will see marijuana, teenagers, they abuse it. That's the most commonly abused substance. And for our viewers, they can actually look at the data, the National Center for Drug Abuse Statistics. And then comes other substance, hallucinogens, which surprisingly, it's in adults,
Mm-hmm.
it's not as common as it's common amongst youth. Again, as we know, hallucinogens, that's giving you a perception, false perception, whether it's auditory or visual hallucinations, things that are not there, Of course, illusion is, you see something and you think it's a snake instead of a rod. So, but delusion is a false belief. But hallucinations, it's just a false perception. So for some time, some period of time, you're just living in a false perception, and you're loving it because you're abusing it, and that's really, really dangerous situation, especially for our youth. So that's the second most common. Then comes benzodiazepines or tranquilizers or sleep pills, you can say. Those are the lowers, they decrease your respiratory, they induce respiratory suppression, especially if you combine it with the opioids, which
Mm-hmm.
is the next on the list. So you combine opioids with the benzodiazepines, end result is drastic, and
And
that's what we are
unfortunately,
seeing
I
more.
see this all the time, right?